Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Do you feel you're getting old before your time? Are symptoms piling up with no answers in sight? What if it's not your age, but your hormones? Mission Evolution Radio Show is coming to you around the world on the Voice of Canada Broadcast Network, www.vocbn.ca. With us this hour to explore the devastating effects of hormonal imbalances is Dr. Aimee Duffy. Dr. Duffy is a renowned expert in functional hormonal health. She began her medical career as a board-certified family practice physician, treating a broad range of patients, including pediatrics, geriatrics, and women's health. In 2007, Dr. Duffy joined a thriving obstetrics and gynecology practice, after which she began focusing on hormonal imbalances, thyroid dysfunction, adrenal fatigue, and sustainable weight management. In 2011, Dr. Duffy opened Carolina Integrative Medicine, a practice dedicated to whole person wellness. She's the #1 best-selling author of Normal Doesn't Have Side Effects and Why Can't She See Me? Her website, carolinaintegrativemedicine.com. Dr. Duffy, thank you so much for joining us on Mission Evolution.
Hello, thank you for having me.
It's wonderful to visit with you again. You started out as a family practice physician. What inspired you to focus on women's health and functional medicine in general?
Well, I will tell you that I absolutely loved babies. Like when I was a little girl, I wanted to hold all the babies, and I had, Cabbage Patch Kids with all the accessories and everything, and I just practiced babies all the time. So one of the things that I loved about family practice specifically is sort of being able to encompass the whole family aspect with, pediatrics all the way through geriatrics, but also obstetrics as well. So in my training in family practice, I did a rural health residency program. So we were in small town here in South Carolina, and there was, lots of babies to deliver. And our residency program was the one who did a majority of those deliveries. So I really got a lot of experience in the family practice realm with babies and delivering babies. And so, in that world of obstetrics, if you want to call it, it kind of blends obviously with GYN and women's health and hormones. So that just kind of became my niche. And so, like you said in the intro, I was lucky enough to get recruited, if you want to call it, by one of the OBGYN offices in our community, to work with them to do primary care for women's health, because a lot of women go to their GYN and that's really the only doctor that they see. So they kind of use their GYN as primary care. So we really had a nice little blend of me doing the primary care, helping with the obstetrics call and deliveries, and then they were doing more the GYN surgeries and things like that. And so, just diving in literally like 1 year after I finished my residency program, that's really where I lived. And I found myself sort of in an unknown place. In residency, we didn't really do a ton of training on hormone replacement and hormone issues outside of just, different types of birth control you can use if somebody's having irregular periods or something like that. So I found myself sort of in an unknown area with needing a lot more knowledge with the conversations I was having with my patients. So I really wanted to learn more and understand more about what to do with hormone challenges. And that brought me into finding the world of what we call bioidentical hormones, which led to sort of functional or integrative medicine and looking at, hormonal imbalances and how they affect people, not just, a checkbox of, are you menopausal? Yes or no? Do you have a uterus? Yes or no? So that's really where I started in this world of really diving into women's health and hormones.
Yeah, when you were delivering babies, was there a lot of hormonal imbalances you were seeing among young women?
Not obviously. Well, I shouldn't say obviously. People don't know. I mean, if you're able to get pregnant, generally your hormones are doing what they're supposed to do, right? So in the world of obstetrics, in seeing women who were already pregnant and, delivering babies, we didn't see so much hormone stuff there, but the population that I saw, in the clinic, like on the days when I wasn't delivering babies, was a wide array of, young women up to older menopausal women. So we definitely started seeing some changes with, girls in adolescence or into their 20s that maybe were having some issues with irregular periods or, mood, mental health type stuff, acne issues, that sort of thing that would present itself that way. Yeah.
So do you think that the cases of hormonal imbalances are rising over the years from what you've seen?
Absolutely. And I can tell you my opinion based on, my experience and learning and education and whatnot is that I think it is 100% related to the stressors that we're seeing, and whether that's just our life stressors coming at us. I think we can use the term stimulation as opposed to stress. So it doesn't always have to be something negative, but just, sort of the constant stimulation that our bodies are being exposed to, whether that might be notifications on our phone, light therapy, more TV, more computer time, that sort of thing. I feel like when you look at somebody who, I kind of find it fascinating. We're diving into the world of adrenal health to some degree and looking at cortisol, which is our stress hormone. And I measure that in all of my patients. And so I'm seeing more and more abnormal cortisol in younger people. When I first started this in training, it was like, oh, you're going to see, you might as well not even test a young person because their cortisol is going to be normal. And we're not going to see the abnormals until they get, into their, late 30s or maybe 40s and 50s and beyond. And then on the flip side, seeing women that are in their, almost 70s and 80s having almost normal cortisol, which was weird because I didn't really expect that. But I think they sort of skipped that whole stimulation. I mean, there are women now that are, using their phones and everything like normal. But I think when we think back about, for me, I'm almost 50. So when I was a kid, we did have some TV watching, but we didn't have our phones. We didn't have computers. We spent a lot of time outside, right? And we did have activities, but it just seemed like it wasn't quite so demanding on our time. So part of it is stressors and stimulation. And then, we can dive deep into this too. I think our exposure to the environment and toxins with what's available in our food. Again, when I was younger, we didn't have so much fast food. I mean, we did have McDonald's, but it was very rare that, we would go to McDonald's or Taco Bell or something like that. I mean, most people ate at home, right? And we just didn't have this exposure to all the fast food and the chemicals, I would say, that we're seeing today that are in our foods and our environment. And I think that plays a huge role on our stress, on our system, and in our hormones.
It seems to be we're being stressed on every angle.
Absolutely.
The thyroid is interesting.
Mhm.
Are you seeing a lot more hyperthyroid? And do you think it's related to what do you think it's related to? I mean, I know we have more radioactivity around than we used to.
Yeah.
What do you think it's related to,
Let
the
me just
thyroid
clarify
issues?
your question. You said hyperthyroid, or um
Yes,
you mean hyper versus
hyper
hypo?
or hypo, either one.
Okay.
Thyroid dysfunction. Let's put it
Yeah.
that way.
I
Yeah,
just want to clarify that because I generally don't see a ton of hyperthyroid, which is your thyroid working too much, overdrive, right?
right.
Um,
Hmm.
like Graves' disease is a an issue when somebody has an autoimmune disease that is making their thyroid kind of work overdrive. That's really rare, and I tend to not see that very often at all. But definitely see thyroid dysfunction, like you said, and whether you want to officially call it hypothyroid, which means that your thyroid is not functioning and not kicking out the amount of thyroid hormone it needs to. Um, yes, we see that, but I think more what we see is Hashimoto's, And
Hmm.
it may be because we're testing more, but Hashimoto's is an autoimmune disease where your body makes antibodies against your thyroid, also against the enzymes that help to your thyroid hormones convert to be active and do what they're supposed to do. So I definitely think we're seeing more and more of that, again, related to our gut, our immune system, our food sources, our um, lack of diversity in our microbiome, meaning like we're almost too clean, to some degree. We're being exposed to all these chemicals, and yet we're not being exposed to the dirt the way that we need to be. So we don't have all the good bacteria in our guts that we should, which can play a role in how our immune system works. So absolutely, we're seeing a lot of thyroid dysfunction as well.
So, I remember going to a doctor not too long ago. I said, "Hey, could I be having adrenal fatigue?" And he says, "There's no such thing." And I'm
Yeah.
going, "Okay."
Yeah.
So, what are you seeing there?
Oh, 100% adrenal dysfunction. And I love talking about adrenals. That's something I teach in conferences all the time. And I just think it is under discussed, particularly in the general medical field. I mean, we only had maybe a one-time conversation on, the potential that you might come across somebody that has Addison's disease, which is extremely rare. I never saw that in my career even. But definitely seeing the adrenals not producing the amount of cortisol that they should, because they have been overproducing cortisol for some time with all the stressors and the stimulation I was telling you about. So, whether we have all this outside stress related to our work, our home, our finances, our relationships, whatever the case is, but we also have all these internal stressors. So every time you eat something or you're exposed to a chemical or something that your body goes, "What is this? What do I need to do with it?" It's a little bit stressful on your system, and it will kick out extra cortisol. And so over time, when we're supposed to have kind of this normal everyday cortisol's high in the morning, which is what wakes us up, the sun comes up, it's time to get up, and over the course of the day, it goes down. We now are asking our adrenal glands to kick out a little bit extra cortisol here for this 10 o'clock appointment. And now I ate lunch and I ate, you know, fast food that's full of chemicals and things my body doesn't know what to do with. So I got a little blip of cortisol here. And, throughout the day, you're just asking the adrenals to work, a little bit harder than what their norm is. If you multiply that over weeks and days and months and years, the adrenals over time go, "Oh, I'm tired. Like I can't keep sprinting this marathon of life all the time without some relief, without some rest." And so we actually see a lot more low cortisol in our patients and in our world, which we call adrenal dysfunction or adrenal fatigue that you alluded to. And I think one, again, in traditional medicine, it's not even touched on, but two, the testing of that is a little bit tricky. We actually do salivary testing in my practice, and that's how I learned about adrenal dysfunction, is learning about saliva testing. So you can collect these samples. Basically, you spit into these little tubes, and we
Well,
look at it four
we're
times
going to
throughout the
we're
day.
going to have to
Yeah.
pick up on this on the other side of a station break.
Okay.
Dr. Duffy and I will return very shortly, so don't go away. This is Mission Evolution, www.missionevolution.org.
The end has come, the night has fallen. I have reached the end of days. What's real is not, reason fails me. I've gone beyond all known pathways. This is the end of reason. This is the end of time. I am alone, alone and broken.
Has your get up and go got up and went? With us this hour exploring hormonal health is Dr. Aimee Duffy, the author of Normal Doesn't Have Side Effects, and her website is carolinaintegrativemedicine.com. Dr. Duffy, what are the symptoms, speaking of get up and go, what are the symptoms of adrenal fatigue and or, thyroid dysfunction?
Yeah, they they can cross over for sure. It can be very confusing sometimes, which is why testing is so important. So we'll dive into testing a little bit. But the most common symptom that I would see with either one of those is that get up and go, the fatigue of just, I feel like I slept my normal amount of time, but I just don't feel like, waking up. I don't get up in the morning and bounce out of bed and do all the things, going throughout your day, or maybe you're fine in the morning, but you hit that, 2 p.m. or 3 p.m. kind of crash. We'll see that. We'll see I've pushed through the day. So I get through work, I get through my day, I give everybody else in my job and my coworkers, whatever, my all and everything that I have. And then I get home and I just have nothing left. So I'm on the couch from, 5:30, 6 o'clock until I can crawl myself to bed in the evening. And then sometimes we'll get what we call tired and wired. So you're exhausted all day. You're like, man, I can't wait until it's bedtime. And then once you're able to lay your head down and your head hits the pillow, now your brain gets busy and it goes, what are all the things that we didn't do today and accomplish, or what are all the worries I have for tomorrow or whatnot? And so, you have difficulty falling asleep. So that's a very common thing to see, is the tired and wired. I think some unusual symptoms, or symptoms that you wouldn't necessarily expect to see, with low cortisol, and you can see it with high too. So imbalances, and same thing with thyroid, is imbalances or dysfunction in the thyroid can present multiple ways. So fatigue is one, difficulty losing weight. It's like, I feel like I'm doing all the right things that I read about or think I should be do, which is, maybe cut back on my calories, or I'm moving more, I'm trying to exercise more, yet nothing seems to be happening. There's some, metabolic issue going on that's not letting that happen. So I see that. And then my favorite term, because I'm a margarita girl, so is margarita time. And I think it's kind of funny, but it's like this craving of carbs, but particularly salt and sugar, and kind of this back and forth between, I need something salty, now I need something sweet, now I need something salty. So margaritas with salt on them is that salt, sweet, sour kind of blend all together. I see that a lot with adrenal dysfunction, where even though you have the brain power and the motivation to eat healthy, by the time your adrenals are done, by the end of the day, you're just in that snacky mode. And a lot of times that's a frustration too, because you want to exercise and get some more movement in, but you're just too darn tired to be able to do it. Brain fog is a huge one. It's just I used to be smart as a tech. I could remember everything. I was on track with, what I needed to get done at work. And now it's just like, I'm working through this fog, and I can't see straight, and I can't focus, and I can't remember things that I used to be able to remember. So, feeling that memory, and brain fog kind of symptom is another big one that you don't really put together as an obvious symptom for either adrenal or thyroid dysfunction. So those are a few. There's lots.
So, do you find that hormonal issues are misdiagnosed by mainstream medicine a lot?
Oh yeah, I do, because I think, for me, we're talking about thyroid, and we're talking about, well, for both of us, but we're talking about thyroid, we're talking about cortisol, which is a hormone, right? I think when you think traditional medicine and you say, is there something wrong with my hormones? Immediately we think about, estrogen or progesterone, or even testosterone sometimes. I think that gets overlooked as well in females. But so the first question is, I'm thinking a younger person, maybe in their 30s or 40s, and it's like, oh, well, if you're having periods and cycles, then your hormones must be normal, right? So there's no point in testing hormones, because they're going to be okay, right? Or if you're menopausal and you say, I'm having hormone issues, if you're not having the obvious hot flashes or decreased libido or something like that, that seems like, oh, this is definitely a hormone thing. they may or may not test your hormones, or they may just offer you treatment. And I think what we're missing in mainstream medicine is that it's all so interrelated. If we're not looking at adrenal function, you're not looking at thyroid, you're not looking at all of the different hormones, estrogen, progesterone, testosterone, DHEA, all of those things, I think an imbalance or a dysfunction can be missed. So 100% it's not being looked at in mainstream medicine in the right way.
And even if it's looked at, how accurate are the tests? I mean, the high and the low that
Right.
they say is acceptable. How accurate is that?
That can get very tricky. So let's talk about thyroid, because that's a really easy one to look at. Is there's a lab test that is called TSH, or thyroid stimulating hormone, that's measured, and that's the most common test. If somebody was going to say, hey, maybe you have a thyroid issue, let's test your thyroid, right? That's very common, and it's often misdiagnosed as normal, if you want to use that terminology, or seen as normal, even though it might be abnormal. And this is why. So that particular test has a reference range that can range from like 0.4 to 4.5. And this is true of any lab and any test, but this is just in this example. How did the lab determine that 0.5 to 4.5 is, quote, normal or within range? Is they just basically took all the people, let's say there were, 10,000 people that came to the lab and had that test done. They literally did routine statistics and said 95% of the people that came to the lab had this test done, and this is what the range is. And so therefore that's normal.
Well,
And
that's lovely, because they probably came to the lab because they have a problem in the first
exactly,
place.
right? So they
Yeah.
came with a problem. They may or may not be on thyroid medication already. We never had a question about whether they had symptoms or not. How old are they? Are they menopausal? Are they male? Are they female? Like, all those variables did not get included in this range, right? What we found in what we call integrative or functional medicine, what we do in the hormone world, or bioidentical, is that true normal, if you want to think about it, or optimal levels for that test is between 1 and 2. So even though the lab says you are within range, if you're at 0.5 or if you're at 4.2, really what we see is that range should be between 1 and 2. So if
Oh
it's
my goodness.
high,
Yeah.
let's say it's 3.5, your traditional doctor is going to say, oh, nope, it's not your thyroid, everything's normal. Where we're seeing, okay, that elevated TSH is your brain sort of, kicking it up a notch and yelling a little bit, if you want to call it, at the thyroid to say, hey, you need to produce more thyroid hormone. You're not doing a good job. So that can be just a very subtle, noticeable change that somebody may not pick up on, or say, oh, this looks normal, everything's fine, when really we're starting to see some dysfunction in your thyroid ability to kick out the right amount of thyroid hormone.
And you're probably feeling it physically. So what is functional hormonal health?
When we think about functional medicine, there's various degrees of definitions, but functional means how are we functioning, right? And what is optimal? And is everything functioning in that perfect, wheels churning? I think about like the wheels in a watch, right? Or everything really needs to be in flow together. And is everything functioning at its optimal, really? And so when we think about functional health or functional, whatever the case is, we're talking about thyroid, it's again looking at that big picture. So in my world, if I'm looking at thyroid, I'm not just looking at TSH, but I'm actually measuring, free T3 and free T4 and those antibodies that we talked about if you had, Hashimoto's or some autoimmune disease. And again, we're looking at the big picture. So is everything functioning at its best and functioning together optimally? So that's really what we look at when we're talking about functional hormone health.
So you speak of health challenges that hold women captive. What do you mean by that?
Can you repeat your question again? I'm sorry.
It's okay. You speak of health challenges that hold women captive. What do you mean by that?
I think, what we're seeing, especially one of my focuses that I really like to talk about is this woman in perimenopause, which is just sort of like, still maybe having menstrual cycles, and And, so going, okay, I know I'm not in menopause yet, but yet I just feel not good, right? And generally this is going to be somebody in their 40s, maybe their mid 40s to early 50s. And this is also a time where we're knee deep in our careers. We're probably, chin deep in our families, whether you have young kids or you're dealing with teenagers. It's also an interesting time where maybe older parents are becoming uh, in a place where they need more attention. So I think this age for a woman is just starting to hit from all different directions. And we do a really good job. I'm going to put my we in there because I have 4 girls and run a business and whatnot, is that we really do a great job of paying attention to everybody else and not a really good job of paying attention to ourselves. So we tend to just sort of push through it. I don't feel good, but I don't have time to think about it, so I'm just going to keep going. I've gained 20 pounds. I'm just going to buy another t-shirt at Walmart, like just kind of, not even paying attention maybe to a symptom that might be slowing you down, and you just over time just start to get worn out. And it can often present itself more as a mental health challenge. So are we depressed? Are we feeling anxious? Are we overwhelmed? I can't handle all these things. And, it's not necessarily a serotonin deficiency or a Zoloft deficiency or Prozac or whatever. It's more this imbalance because of the adrenal dysfunction and the stress we're putting ourselves under, along with this time in our lives when we're starting to see some hormonal changes, but it may not be obvious. So I think those women are held captive. They're not living the life they really want to live. They're in survival mode. They're just getting through their day. What do I need to do to take care of everybody else? And I'm going to crawl in bed and I'm going to try to get the sleep I know that I should be getting. And maybe that's, again, a time where they lay awake or they wake up frequently throughout the night, worried about everybody else and maybe starting to worry about themselves, but not having an obvious sort of medical symptom, if you want to call it. There's no headaches, there's no, chest pain or something like that makes you worry, but it's just kind of this underlying, I don't feel right. I don't feel like myself. I don't feel normal. Again, that energy, that mood, I'm getting through my day, but I'm not happy. I'm not relating to other people the best way that I can. That's what I mean by that.
Well, we're going to have to take another station break. Dr. Duffy and I will be right back to continue our discussion. So you stay right there. This is Mission Evolution, www.missionevolution.org.
The end has come, the night has fallen.
I'm not an alien. It's only menopause. This is Mission Evolution, missionevolution.org. With us discussing menopausal myths is Dr. Aimee Duffy. Her website, Carolina Integrative Medicine.com. Dr. Duffy, let's move on to menopause. Menopause is something all women face, but does it have to be so miserable and debilitating as we all believe?
Absolutely not. And this is just, for me, and I know a lot of my colleagues that are in our, functional integrative bioidentical hormone world, we are on a mission to, help women as well as other practitioners to understand that, menopause is a really, it can be, and it should be just, flipping the page to the next chapter in your life, right? And it should be, for many women, a great opportunity to sort of recalibrate, wherever you are in your career. You may be having your kids moving on to college, et cetera. So you have kind of a new life at home from that perspective in terms of empty nest, things like that. Maybe you're going to have grandkids. And so you want to have that energy. And I think, we've done such a disservice in the hormone world of creating this fear that hormones are scary and hormones are bad. And so therefore I can't be on hormones, even though my body is screaming for some hormone help. And we just then decide it's okay or normal, if you want to call it, to suffer and just be miserable, whether it's because of hot flashes, which are very common, but we see, hair loss, we see that midsection weight gain, fatigue is huge, difficulty sleeping, the decreased libido, the painful intercourse, just again, not feeling myself, a lot of that moodiness that's not quite depression, not quite anxiety, but a little bit of irritability. I don't like anybody around me, don't touch me, that sort of thing. And so women are just living this life that is not their own, and they don't feel good. And yet they're feeling like there's no option because they don't want to be on an antidepressant. They don't want to be on hormones because they're afraid of hormones, that there's a risk of breast cancer or strokes or things like that. And that's been well disproved in a lot of more recent studies lately, but still, through the media coverage of the Women's Health Initiative 25 years ago now, even practitioners are terrified of hormones and telling women they can't be on hormone replacement.
And that's so sad,
Oh,
because
yeah,
we're living in an environment that causes hormonal imbalance,
exactly.
and yet we're unable to treat it. There's also an attitude towards growing older, particularly towards women growing older. I mean,
Hmm.
there's the myth that there's nothing more useless than an old woman, right? And how much do you think that dread, that attitude, also contributes to the angst that we go through
Oh,
during menopause?
absolutely. I mean, I do think that it's a very depressive time if you want to think about it. If we have watched, a loved one go through that and see them sort of, wither away, if you want to call it, or dwindle away or change their personalities, or, had some significant health dysfunction, and you start to see that in your own self as you get older and go, oh, am I on the path to, it's all downhill from here, if you want to think about it. What's the birthday party theme where it's like over the hill and you've got the black and the um the tombstones and things like that for your 50th birthday, right? It's like this that's a joke to some degree, but it's like this idea that you turn 50 or 55 and you might as well check a box of I'm done, right? And nobody wants to die necessarily, but it's just this idea that you're going to have the energy and the motivation and the wherewithal to kind of keep doing fun things in life, right?
And
um
there's also the attitude about the only beautiful woman is a young woman, and that
right,
after a
right.
certain age, you're just undesirable and surplus.
Absolutely. Yeah. I'm getting, again, the weight gain, the hair changing, the skin elasticity. So, is that causing like wrinkles and skin sagging and things like that? And again, a lot of that is hormonal. And what I really want to get the message out is that the earlier that we investigate and evaluate and be able to intervene, for lack of a better word, the less we're going to see those symptoms. So a lot of uh, hormone training happens in the world of anti-aging medicine, and it doesn't, or longevity medicine, and it doesn't have to be all this woohoo biohacking stuff, although we can certainly dive into that. But the idea that all of these things are happening, what happens when we turn 50 and you go to the doctor is like, oh, well, now you have to have a colonoscopy and we need to screen for all the cancers and the heart disease increase and all that kind of stuff. And it's like, well, did we not just pause for a minute and go, what happened when we turned 50 and all our hormones went away? And so a lot of research that I do and teaching is on sort of the relationship between the decline in our hormones and the increase in some of those chronic diseases like cardiovascular disease, cancer, bone health, brain health, and cognitive dysfunction. So like you said, not only is it about how we feel and how we look, but are our brains working? And so people go, oh, I'm having a senior moment, I'm forgetting things, I'm getting dementia, I don't remember things, and accept that is normal, and that's just part of aging. And none of this has to be normal, none of this has to be accepted. The earlier we can start to evaluate and see what are the hormone levels, and is there room for us just slightly getting us, and that's what my book is all about, is we just want to get back to normal. We don't have to go crazy and do, bulking up of crazy testosterone or anything like that. It's just, if something is just not quite where it should be, and we get it back to that place where it should be. So like we talked about the thyroid, TSH being 3.5 instead of 1.5, it sounds like it's just a teeny little number, but that can make a huge difference in how somebody feels.
Well, what about men? I mean, they go through something about the same time.
Absolutely.
What's going on with them?
I think men, are a little bit simpler because they really more just have one driving hormone, where women have a bazillion. Although I get, men have thyroid and men have adrenal dysfunction, and we definitely see that. But absolutely, men are exposed, like we were talking about earlier, to the same environment, to the same stimulating things with our phones and our lights and our computers and all that kind of stuff. So we definitely can see adrenal dysfunction in men. We can see autoimmune diseases in men as well. And so what happens for men is they, are cruising around with these super high levels of testosterone in their younger years, and testosterone starts to decline, just like other hormones in women as they go through menopause. We call it andropause, where testosterone levels decline. And, the very classic thought process is it causes decreased libido or erectile dysfunction in men. However, again, that may not be obvious, or that may not be their driving force. It may be fatigue. It may be, again, the weight gain, or I'm going to the gym, but I'm not seeing it change into any effort. My strength is different. My mood is different. They're more irritable again, and kind of short-tempered, if you want to think about it that way. Or, they can look depressed because they're just kind of like, bleh, I don't want to do the things I used to do. I don't feel like doing anything. I'm just going to, watch TV or look at my phone, kind of stuff. So we absolutely will see these changes in men, for sure. They're just less obvious maybe. And again, because it doesn't seem like this is a complaint that I need to go to the doctor because this is a definite change. It's much more gradual. And so I think it just sort of sneaks up on you and you don't realize
So
that that's a hormone issue.
like you said, there's a lot of myths around hormonal replacement for women. How about men and testosterone replacement and heart problems?
Absolutely. So again, this is another area that I teach and research is the decline in hormones is very clearly associated with increases in cardiovascular disease, increases in mortality associated with either strokes or heart attacks. Testosterone is a great thing. Testosterone is anti-inflammatory. It helps open up blood vessels. So it sort of vasodilates, meaning that's a good thing, as opposed to blood vessels being super tight and, causing like high blood pressure, things like that. So, again, testosterone got a bad rap when there was a article that came out in the Wall Street Journal, which is not a medical journal, that described a concern with testosterone replacement and prostate cancer, as well as testosterone replacement and cardiovascular health. And they basically did this sort of observation that, all these men that were in the cardiovascular intensive care unit having a heart attack had testosterone on their medication list, and therefore testosterone caused these heart attacks. And very poor observation when you think about, all the variables that may go into what causes a heart attack, right? But that kind of made people question, is testosterone replacement safe? I also think we probably overdid testosterone a little bit, maybe again 20, 30 years ago, when it sort of came out. It was on the TV, men on the golf course, and like, oh, I'm getting testosterone replacement and it makes me feel amazing. So, it became sort of a thing of, I need to get testosterone, and it wasn't really done well in terms of testing and retesting. It was based on symptoms, and that's really vague and hard. So, try this dose, see how it works. If you don't notice anything, we'll increase the dose, and then we'll double it again. And we'll, so I think there was a lot of overdosing of testosterone.
When it could have easily been thyroid or something else.
Exactly. It wasn't evaluated appropriately to see what all the different, aspects were with, what was either causing the testosterone to be low in the first place, and or were there other things going on that caused those symptoms that we were just chasing with testosterone? So testosterone, just like any hormone, again, I was talking about, we just need a little bit. And it's almost like synergistically, if you do a little bit of everything, you're going to see better results than a lot of just one thing. So I think, testosterone can be overdone. It can be overdosed. And if it's high in somebody, particularly that is overweight and has a lot of adipose tissue or fatty tissue, it can be converted to estrogen. And estrogen in men is not good. And a lot of people don't measure that. They're just measuring, testosterone levels in men and going, oh, it's normal or it's low or, it's not quite where we want it to be. Let's increase the dose. And they never measured estrogen or any of the other hormones. And so estrogen high in men can be stimulating to the prostate, just like breast tissue. In fact, I met a pathologist turned functional medicine hormone doctor who said, under the microscope, breast tissue and prostate tissue look almost identical.
Interesting.
So it can be treated, very similar in terms of if there's too much estrogen stimulation to the prostate, it's going to grow and get bigger, just like too much estrogen in a female can, cause concern for breast lumps and bumps and potentially breast cancer issues. So they have to be treated very similar. Where are we starting? What's the overall look at all the different hormones and all the different imbalances?
Well,
How
we're
does
going
that
to
match
have
with
to
the symptoms?
look at hormones as a whole on the other side of yet another station break.
Sounds great.
Please stay with us as Dr. Duffy and I continue to explore holistic approach to menopause. This is Mission Evolution, missionevolution.org.
I've been broken, shattered, cast to the wind. I am scattered upon the wind. I've been broken, shattered, cast to the wind. I am scattered upon the wind. I've been broken, shattered.
Does menopause have to be so crazy? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Aimee Duffy. Her website, Carolina Integrative Medicine.com. Dr. Duffy, back to menopause. What does a healthy passage through menopause look like anyway?
I think it should it should look normal, if you want to call it. I mean, it should be, I am, feeling my best. I wake up in the morning and I fit into the clothes that I have in my closet that I want to wear. I have the energy to, do the things that I love and want to do, whether that's your work, whether that's relationships, whether that's playing a sport, tennis, getting to the gym, if that's what your love is, going out for walks, hiking, biking, all the things that we start to see, in abnormal transition happen. So, what I want to see for people is that they are loving life, they are living life, and not going through the day just surviving to get through it. So it's about energy, it's about stamina, it's about being in a good mood, it's about having good relationships, whether that's with a spouse or a couple relationship, or relationships with your coworkers or your friends or your children or your grandchildren, or your elderly parents, if that's what the case is. I want you to be able to do all the things that you want to do and all the things that you need to do. Talking about elderly parents, you might be 50 having a 75, 80-year-old parent who's starting to, have some aging issues and lack of independence. And I see that a lot is like, okay, I put my life on hold so I can, take care of my parent. And I absolutely want you to be able to do that. But I want you to have the energy and the stamina to do both, where you can live your life and still have, what it takes to help, your loved one go through whatever they're dealing with too.
There's of course everybody has these horror stories. My mother had a terrible time with menopause.
Yeah.
Fortunately, I didn't follow in her footsteps. But I mean, she had this horrific personality change, and
Yeah.
she was irrational. The things
Mhm.
that she would come say and come down with and accuse people of, and everybody just kind of had to duck. The
Yeah.
house would vacate. I mean, because she was just absolutely, like I said, almost it looked like mental illness. What's
Yeah.
going on there?
Well, like I said, I mean, I think there can be a lot of cognitive dysfunction that happens as hormone levels decline. Hormones are really anti-inflammatory, and you can see studies that show it with progesterone, estrogen, testosterone, cortisol, right? So we were talking about adrenal dysfunction and lack of cortisol. And if you've ever heard of experienced yourself or heard somebody else that went to the doctor and got a cortisone shot for their knee or their shoulder because it was hurt, and that reduced inflammation. So that's synthetic, right? But still it's cortisol, and so that's anti-inflammatory as well. So when we think about inflammation, and I'm getting to the point where you put this together, but when our body's inflamed, and whether it's a joint or our gut or our brain, it doesn't function the way it's supposed to. Hormones also are really important for the transitions of your neurotransmitters, so the pathways for serotonin and dopamine and GABA and glutamate that regulate our mental state, our moods, our sleep, our energy, that sort of thing, are definitely connected to hormones and hormonal imbalance. So as we start to see hormones go away and or change, then all the things change. Again, you think about the spokes in a watch or a clock or something like that, and all this idea of every all the wheels turning and moving smoothly. If you take half a wheel away, or you take some of the spokes off that used to be there, then you're not going to see everything turning in tandem the way that it should.
Hmm. So, what advice do you have for women just starting to experience perimenopause?
I think 100% to not ignore, that this could be a change, because I think, again, oh, well, I'm still having periods or I'm not having hot flashes, so therefore this can't be menopause. It's not officially menopause yet because you're still, having cycles, and your hormones aren't quite there yet. But there's definitely a time where we're going to start seeing some changes happening, and whether that's a change in your progesterone levels. We see a lot of low progesterone along with that low cortisol. So it's a great opportunity to just check in and say, hey, something doesn't quite feel on, I feel not quite right. So let's take a look. And like I said, let's look at a full thyroid panel. Let's look at your cortisols through that saliva testing we started to talk about earlier. Let's look at all the hormones and where they are. And you may start to see where, progesterone levels decline up to 10 years before estrogen starts to decline. So we can certainly start to see some of these symptoms and changes, for women in their early 40s even, or late 30s, before they come even anywhere near menopause. And again, women in their 40s, the number one prescription is, sorry, I'm losing a umbrella there. The number one prescription is Lexapro. And then the number two prescription is birth control pills. So, we're starting to see some changes in our hormones, and we're starting to see, some, like you said, some of those mood symptoms. And it's like, are we just band-aiding them with a medication like an antidepressant? And most women are going, well, I'm not really depressed. I don't think that's my issue, but I just don't feel good again like I want to.
So, how can women advocate for themselves in a healthcare system that often dismisses these concerns?
Well, hopefully they're listening to things like this, right? So that, it's all about talking about it. It's all about getting educated and becoming your own advocate to some degree. And I think it can be difficult when you're reading an article, or you're listening to this show or to another podcast or something like that, and saying, oh, they're speaking to me. I have all these symptoms of perimenopause. I'm going to go to my doctor and find out. And this is not, to say that doctors don't know what they're doing, but I think in the traditional medical world, it's a band-aid system, and doctors are only allowed, because of the number of patients they have to see, you only get that 7 to 10 minute time frame. And so it's very easy to say, oh, you have a symptom, let's just pop a birth control, or let's just pop an antidepressant prescription on there, check the box, off you go. I took care of that day, and not really being able to have the time to look into it a little bit deeper. So in that sense, get educated about what you're looking for and what verbiage you want to see, and then do some searching to find a provider in your area. We're teaching all the time, and there's a lot more providers than there used to be that are doing this, functional, integrative, bioidentical hormone medicine.
That's a wonderful thing, because if you're, being dosed with antidepressants and or birth control, particularly birth control pills, doesn't that run the risk of making the matter worse rather than helping?
Absolutely. I mean, that adds a chemical, right, to your system that it now has to go, what do I do with this? So, 100% it can throw you for a loop and change things in a way that you don't really want it to. And, birth control pills have a place. I'm not saying no one should ever be on that, but, they are used for contraceptive purposes in a younger person who is, in a place in their life where they're not ready to have children yet. So I think they are fine, and they have a place for a short term in that part of life, but they should not be used to treat a symptom of hormonal imbalance in, a woman who doesn't need it for contraceptive purposes. If they've had their tubes tied, or their spouse has had a vasectomy, or, whatever the case is, and they're just band-aiding it to control a symptom, that's not appropriate use for that type of medication, for sure.
So how can we turn midlife into an opportunity rather than this kind of a challenge?
Oh yeah, I think the earlier that we can see it, the faster we can be aware of what's going on. The more we can see adrenal dysfunction, the more we can learn what are the things that I can do. So, whether it's some lifestyle changes with just an awareness of what is my body being exposed to, whether it's external stimuli or internal stimuli from our foods or from the chemicals we're being exposed to. So, there are some things that we can do before it gets beyond a point where you can fix it, right? So there are definitely some things that you can become aware of in terms of lifestyle changes. There are, supplements that we can use to support hormonal imbalances like low progesterone and adrenal dysfunction, that sort of thing. I mean, I don't want to go just searching for a supplement and band-aiding it if you don't know exactly, but the more you can find out information early and do some smaller changes, and then you can really dive into this and go, okay, I've got this under control and I'm feeling the best that I've ever felt. I mean, I feel better in my 40s than I did in my late 20s and 30s, right? So really getting an understanding of what's putting stress on your system and how can we manage that. And then finding a practitioner that can help guide you through that through testing. And if we do need hormone replacement, whether it's just progesterone or whether we're diving into some estrogen, testosterone, that sort of thing, then we can get a handle on it. And we know, again, from those studies in chronic diseases like cardiovascular, cognitive health, bone health, that sort of thing, the sooner we see hormone replacement, the better result we're going to have.
Well, we're getting close to the end of our time together, and I would be remiss, Dr. Duffy, if I didn't ask you, what is your mission?
Oh gosh, a huge part of my mission is education. You can hear, I mean, I want this message to get out that you don't have to suffer, that it's not normal to feel the way that you feel. So I just want people to be aware that this is out there and that there are answers, whether it's me, I mean, I'm in South Carolina, North Carolina, happy to see you if you're here. But if you're listening from somewhere, other than here, or, another country even, do you have enough of an understanding that you can do even a Google search to say, I need a functional medicine, or somebody that specializes in bioidentical hormones or something like that, that you can get the help that's out there, because it's there. And I'm on a mission to teach other practitioners about this, as well as to help other practitioners who may be, diving into this. How do they incorporate it into their patients and their practice? So, it's not just about me and my interaction one-on-one with my patients, but with the world, really. The more we can get the message out, people are going to live better, happier lives.
Well, bless you for doing it. Unfortunately, we
Thank
are
you.
out of time. Dr. Duffy, thank you so much for coming on the show. Our guest this hour has been Dr. Aimee Duffy, a renowned expert in functional hormonal health and the #1 best-selling author of Normal Doesn't Have Side Effects and Why Can't She See Me? To find out more about Dr. Duffy, where you can find her books and all she has to offer, visit her website, carolinaintegrativedmedicine.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy our past archived episodes, visit missionevolution.org. But most importantly, please be sure to join us again right here on the Voice of Canada Broadcast Network, vocbn.ca, where this mission will continue, bringing information, resources, and support to our evolving world.